Good day, viewers. Equad Blog is reporting live at the Nigerian Institute of Medical Research, Yaba, Lagos, for the NIMR ICHAIR Week. The acronym ICHAIR stands for International Conference on Health Advancement, Innovation and Research. It's an international gathering of biomedical professionals where discussion about advancing biomedical research and the general well-being of the world is discussed. So stay tuned as Equad Blog brings to you all the live updates of the event as it unfolds. I am Daniel Samson Idowu, reporting for Eco Hot Blog. The Nigerian Institute of Medical Research, NIMR, held its 14th Annual International Conference on Health Advances, Innovation and Research, ICHAIR, welcoming students from various institutions across Nigeria. The conference brought together intellectuals, professionals, and scholars in the field of biomedical research and practices. The ICHAIR conference, established in 2010, is an annual gathering of international biomedical professionals aimed at discussing critical issues on health, biomedical research, diagnostics, and emerging trends in pathology. This year's edition featured sponsorship of medical students from various institutions across Nigeria, including the Federal University of Ilorin, Adamawa Teaching Hospital, and Borno State University, among many others. The logistics and welfare of invited students were fully covered by the Melinda Gates Foundation and the Japan International Cooperation Agency, JICA, who are the major sponsors of this year's event. Professor John Obafunwa, the Director General of NIMR, hosted prominent figures in biomedical sciences, including health administrators and academics. Notable dignitaries present at the event include Dr. Tunji Alausa, former Minister of State for Health and Social Welfare and current Minister of Education, as well as Professor Akin Abayomi, Lagos State Commissioner for Health. The three-day 2024 ICHAIR conference took center stage from November the 27th to November the 29th, 2024. It began with a pre-conference keynote address delivered by Professor Akinsanya Oshibogun of the Department of Community Medicine, University of Lagos. The event also featured the 12th Distinguished Lecture delivered by Dr. Agatha Nkiruka, Director of Research and Consultant Pediatrician from NIMR's Department of Clinical Services. Several abstracts and symposium sessions, along with a skill-building workshop on molecular biology, were done on the first day. The second day, which marked the official opening ceremony, began with the formal opening remarks delivered by the chairman of 2024 ICHAIR conference, Professor Akin Abayomi, the Lagos State Commissioner for Health. He addressed the gathering, urging young scholars and medical researchers to adopt effective research methodologies for impactful outcomes.
The Nigerian Institute of Medical Research is the quaternary center of academic learning in this country, the highest citadel of knowledge discovery in the field of medicine and science. It is such an honor to be here, Deputy Director General, amongst a plethora of high intellectual capacity. I've looked through the agenda, I've looked through the papers that have been presented, I've looked at the workshops that are being carried out, and may I say on this occasion that I did not expect less. What is happening in the last day, today and tomorrow, is a demonstration of the fact that Nigeria, under the right circumstances, with the right encouragement, with the right resources, can become a powerhouse of knowledge discovery, innovation, and development.
Following the Commissioner's opening address, the chairperson of this year's NIMR ICHAIR Conference Planning Committee, Dr. Adeshola Saidat, stepped up to the podium to deliver a keynote address. She acknowledged the sponsors of this year's conference and commended the planning committee members on their commitment to the planning processes.
It gives us great pleasure and on behalf of the Director General and this year's conference committee, we welcome you all from within and outside Nigeria to the 2024 NIMR ICHAIR conference. The NIMR ICHAIR conference, hosted by the Nigerian Institute of Medical Research, dates back to 2011. The conference aims to bring together postgraduate students, researchers, academic scientists, professionals, and government realms together to network, exchange, and share their experiences and research findings on different aspects of medical health and basic research related to both medical and public health.
Also, the chief host of the 2024 ICHAIR conference, the Director General of NIMR, Professor John Obafunwa, took to the stage to appreciate the dignitaries and invited guests present at the event, and also commended the planning committee for their selfless efforts in putting together a flawless agenda for the 2024 ICHAIR conference, while also appreciating the sponsors, JICA and Melinda Gates Foundation.
I want to thank the chairman of the LOC and other members for putting together this conference. I sincerely thank our keynote speakers, collaborators, sponsors, supporting organizations, and all you participants. Apart from the challenges of climate change, consequences, and other natural disasters on national and regional health, global health is currently increasingly threatened by evolving public health issues. We know that when these things appear in the country, if Lagos State is not careful, it gets to the rest of the country. And I want to seize this opportunity to thank Lagos State for what it has always done to support and protect the rest of the country. In these 3 days of NIMR conference, we will delve into the latest advancements and innovations in public health. Our conference program features an impressive lineup of keynote speakers, oral presentations, posters, and much more.
Then, Dr. Joke Ajiboye, Senior Representative of the Japan International Cooperation Agency, JICA, delivered a warm remark emphasizing the commitment of JICA towards promoting and contributing to the growth of NIMR.
I'm here on behalf of the Country Director for Japan International Cooperation Agency in Nigeria, Mr. Susumu Yozirio. So it's with great pleasure that we at the Japan International Cooperation Agency, that's JICA, extend our heartfelt greetings and congratulations to NIMR on the 14th edition of ICHAIR. This gathering marks a significant step towards advancing health research and innovation in Nigeria, and we are honored to be part of this moment. So at JICA, we do have a long-standing commitment to supporting the development of Nigeria's health sector. JICA has facilitated research opportunities for Nigerian professionals at some of Japan's leading universities through programs including the Program for Fostering Global Leaders on Infectious Disease Control to build resilience against public health emergency. It's important to build this strong academic relationship because the Nigerian Japanese Research Institute, with the hope that it leads to future cooperations between both countries, institutes, and joint research that can contribute to eliminating the burden of infectious diseases in Nigeria. Other opportunities that JICA provide are master's and postdoctorate programs that offer comprehensive training and exposure to cutting-edge research in various scales or various fields of the health sciences.
Other prominent invited guests, such as Professor Kabiru Akinyele from Lagos State University, among many others, delivered his warm remarks while acknowledging the indispensable impact of the NIMR ICHAIR conference over the years.
For their roles in encouraging research even beyond their own stay here by trying as much as possible to collaborate with other sister institutions here in Lagos, across Nigeria, even beyond Nigeria as well. Currently at Lagos State University, I am the director of linkages, partnership and collaboration, and that will give us an opportunity to further collaborate with this institute, who has actually made tremendous achievements in the health research, in the health and science research. On that basis, I congratulate the DG for and the entire members of NIMR for this conference, and I hope that the new DG will continue to add value to the existing development that are in this great institute. Thank you very much for giving the opportunity.
Professor Akinsanya Oshibogun of the Department of Community Medicine, University of Lagos, delivered his keynote address to bring the first session of the day to a conclusion.
So, you will see that research affords us the opportunity to answer questions or to solve problems. And I've given an example already. One problem was that Lagos State government was spending too much on COVID patients. Was there a way that we could answer the question as to how much exactly should we be spending on a COVID patient? And we were able to answer that question to say, no, we don't need to keep them for 2 months. We'll keep them only for 2 weeks, for 14 days. And that, became a huge savings, because at times people think that health, only consumes resources. They don't know that also there can be savings in health. That became a huge savings for Lagos State government. So research can help us to answer questions or to solve problems, and we can do research in different ways. We can look into historical records, we can do desk reviews, and then we can conduct research to collect fresh data. So you can have primary sources of data and you can have secondary sources of data.
On the interval, the day 2 also featured a panel discussion on Mpox chaired by Professor Akin Abayomi and Professor Rosemary Ajuma.
I would like to know where are the primary hosts of the Mpox virus, and why are we suddenly seeing a resurgence or an increase in number of clade 2 Mpox cases in Lagos?
In 2017, we had this outbreak of Mpox. We had cases in Bayelsa. And from Nigeria, some cases have been exported outside of this country. But in 2022, there was this outbreak that it went, let me say, global, Europe, Asia, and everywhere. And it was at that point that calls now came out. There were calls for applications for grants, and we responded. I recall that currently in Nigeria we have about, I think, 3 or 4 groups that have international grants working on Mpox. That was because of the outbreak in 2022, when it became a public health emergency of international concern. And so, before now, we have had issues. We've had a few sporadic cases, but because of this outbreak that affected the Western world, we now have this grant opportunity. And there are some research gaps that there are many questions that we did not know about it. Previously, it was just thought that this virus was contacted by close contact. But in the developed world, where they were now having outbreaks, they were now seeing it among sex group. Well, let me say high-risk group, men who have sex with men and stuff like that. So some
On the final day of the 2024 ICHAIR closing ceremony, Professor Obafunwa welcomed Dr. Tunji Alausa, who presented awards to winners of the Director General Young Scientist Contest.
The award goes to Mrs. Rukayat Jimo.
Dr. Alausa encouraged scholars to remain diligent and inquisitive in conducting research that could improve societal well-being.
All the researchers that participated at this conference, thanks for all your hard work. It's not an easy job being a researcher. You put some specimen in the centrifuge for 24 hours, you come out and start analyzing it, doing PCR. You realize that there's nothing. You can't really have any protein or DNA or RNA replicating. It's hard work. It can be very frustrating work, but stick to it. You are the one that's changing humanity. You're the one that's keeping the existence of humanity. So I commend every researcher that has participated, both in presenting abstract and your original research work at this International Conference of Earth Advances, Innovation and Research, which was put together by NIMR. And all the sponsors that are here today, thanks for finding time and effort and resources to sponsor this event today.
As the 2024 ICHAIR conference gradually came to a close, hosts invited guests of honor and attendees expressed their delight about the success of the conference. For Echo Hot Blog, this is Daniel Samson Idowu.
I have the privilege of being deployed to the Ministry of Education by Mr. President Bola Ahmed Tinubu, to go superintend the affairs of the Education Ministry. But as I say, in the social sector of any society, education, healthcare, and social protection are all in the same area. It's all continuum. You can't delink health from education, and you can't delink education from health. So part of what we've pushed when I was at the Ministry of Health is research as a bedrock of our educational development and research and healthcare development. So I'm happy to be back at NIMR today to close the ceremony of their 14th annual research week, ICHAIR meeting. I'm very happy the level of the quality of research activities that has gone in. And I'm more happy, it actually delights me more to see our young researchers actively participating. There's future for this country, and this is what this president believes in, President Bola Ahmed Tinubu, in building the capacity, unleashing the capacity of our youth. And also, with regard as an additional layer to research, to building our research, what we're also going to be doing at the Ministry of Education, we're going to really aggressively drive our STEM, science, technology, engineering, mathematics, and medical sciences. That's part of our agenda, and as well, drive TVET, technical vocational education and training. This is all designed to really cater for the teaming, hundreds of millions of young men and women, to give them life skill that they'll be useful to themselves and useful to the community they live and the entire country, and useful to the world. This president firmly believes in the power, in the capacity, in the ability, in the energy of our youth. And that's what the way this economy is being restructured for sustainability into the future.
Well, I have to admit that a lot has gone into organizing this conference. I must give kudos to the organizing committee, the researchers, and quite a number of people, both in administration and also the finance department, for putting in all the effort to get this thing done. It's been very tough, and it has taken quite a number of sleepless nights, but here we are. This is day 2, and I'm sure by the time we finish tomorrow, it will be a success story. Across the road, you can see the poster presentations going on. It's good. and I appreciate it. First and foremost, my background is even Lagos State. Lagos State University College of Medicine, Lagos State University, and one has had the opportunity of relating to the Lagos State Minister of Health. I used to be the Chief Medical Examiner for Lagos State. And it's no surprise that we had to bring in the Commissioner for Health, Professor Akinbayomi, into this conference. I'm glad he was able to make it. I'm glad he has the backing of the Lagos State government behind him. Whether we like it or not, Lagos State is in the forefront of other states in the country. And Lagos State has done a lot in terms of taking care of the health of the people and preventing certain things from being disseminated across the rest of the country. With the support of the Commissioner, with the support of Lagos State, with some bit of financial muscle at the back of it, we should be able to look at not only areas of infectious diseases, but areas of some public health concern. What sort of water do we drink? What's the prevalence of malaria? What are the new pathogens that you have in the system? You have a number of social medical conditions. People talk about hypertension. It has a social connotation to it. These are some of the areas that Lagos State government can assist us. Again, in the area of vaccine production that NIMR is trying to get into, a lot of work is being done in genomics, and the Commissioner and I were talking before we came down to this session about certain genomic studies that even could go on in Lagos State. You know, you've been having before now things like, oh, who is a Lagosian, who is not a Lagosian, where did the people come from? Is it from Benin? Is it from Ife? I'm just throwing that on the table. I'm not making any categorical statement. But by the time you do genomic studies, you'll be able to know who is who. There's a lot that we can do, and I'm trying to seize the opportunity of the fact that we are in Lagos State, and with the financial backing and goodwill of the government and agencies in Lagos State, there's so much to do.
So, you know, research is the heartbeat of any country's development in whatever discipline you think of, whether it's medicine, whether it's agriculture, engineering, social sciences. So a country that pays attention to research is a country that is planning to develop, is planning to make life easier, more comfortable, and more profitable for its citizens. So we're talking about the field of medicine. Health is wealth. We emphasized on how Lagos and Nigeria were able to shield Nigerians and Lagosians during a time of tremendous global shock and threat. And yet our economy didn't take a dive. And we recorded some deaths, but nothing near what happened around the world. And so it was as a result of the activity of institutes like NIMR, like LASUTH, like LUTH, working very closely with the Ministry of Health, and with the governor being the incident commander. He understood the importance of putting resources behind research to understand what COVID is likely to do to our citizens and likely to do to the economy. So any country or any government that fails to appreciate the importance of research is planning to fail as a government. And so when we appoint doyens of medical academia to institutes like this, like my colleague, the Director General of NIMR, who is known all over the world as a steadfast academic with a list of accolades that can even fill a book. You know, it shows that the president of this country is serious about driving the agenda of research for the Quaternary Research Institute of this country. And so it gives me great pleasure to be here and to support my colleague and to strengthen the ties between Lagos State and the Federal Ministry of Health, because we are privileged to have NIMR seated in Lagos. So we can't allow them to be here and not take advantage of them. And we will use NIMR to make sure that, first of all, we as Lagosians enjoy the benefit of the rich diversity of research that happens here, but of course, promoting them so that that research is impactful across the country and across the sub-region. So this kind of conference is pivotal in the bioeconomy of Lagos State and Nigeria. And, you know, if we could be here for the next 14 days, it would not be time lost. You know, this is one of the greatest events that can happen in this country. And I support and congratulate my colleague, the Director General of the Nigerian Institute for Medical Research, the highest level of research in the medical field in this country.
Well, I think that we need to have the understanding that research is very important, because it helps us to have evidence to solve problems. It helps us to have evidence to answer questions. And in the health sector, you know, there are health problems, so research will help us to provide that evidence. And we've seen that in several instances. I gave the examples of how we used research during COVID to be able to contain the pandemic. And globally, Nigeria did very well. You know, people acknowledge that they were surprised that we were able to cope. So research is very important, but in order for us to be able to conduct useful research, we need to invest in research. And we also need to invest financially and also develop the human capital for research. Because it's one thing to have the money. If you don't have people with the know-how to conduct research, it won't be useful. So you must invest the human capital for research, and you must then invest in the research itself, in the conduct of research itself. And down the line, it pays off. So because research has returns on investment, and the returns on investment are huge. Well, readiness for pandemics will not be limited only to the Institute of Medical Research. Readiness for pandemic has to be a deliberate effort on the part of government, and it has to be multi-sectoral. It has preventive, you know, we must have the ability to rapidly detect, we must have the ability to prevent, and we must have the ability to respond. And all those threefold abilities cut across not just the health sector. You know, so it's a multi-sector approach that we will have to adopt. But there are some core sectors that will have to provide leadership. The health sector is one of them. And then, of course, now we don't talk about only human health. You also have to be looking at animal health, and you also have to be looking at the environment. And that leads us to the One Health concept. You know, and it will, of course, require a multi-sectoral approach to address the issues.
It's been wonderful. Organizing the conference has not been easy, but we started in 2010, and it only gets better every year. It's been good. We get a lot of students. You know that we're not primarily a teaching institution, we're a medical research institution, but we get a lot of students, interns, and people on sewers who come here, and it's been a very worthwhile experience. I feel good. I delivered a distinguished lecture yesterday titled HIV in Children and Adolescents, Winning the Battle Against a Formidable Foe. It was basically about the work we have done here with children and adolescents living with HIV, ensuring that they survive, that they thrive, and that they excel in life. So I am very honored to give the lecture, and receive the award. Challenges to research in Nigeria is the understanding of research by the general public. A lot of times the general public do not really understand what research is, and then the funding for research in Nigeria could be better. I'm sure if you listen to the speech, the various speakers, we need research demands a lot of funds because you're exploring things to find solutions to health-related challenges in Nigeria. I'm talking about health research in Nigeria. So it requires a lot of funds, and the fund constraints in our country. But despite that, we're doing the best that we can, and we're breaking ground. Thank you.
The planning has been rewarding. We have about 224 oral abstracts that will be presented. We have about 33 posters across the auditorium that people will be viewing. We had our pre-conference yesterday. We had AI tool for research, how you can use artificial intelligence to enhance research. And we had another session, laboratory component on molecular docking. So yesterday was quite interesting. We had, then we have about 38 young researchers and students, graduate and undergraduate students that have been sponsored across the country to attend this conference by ICHAIR. So, and from today, tomorrow we'll be having oral presentations. We're having a symposium later today on mpox. We're going to be looking at the research activities in the last few years in Nigeria on mpox, the clinical management, and also the community perspective of mpox. Later today also we'll be having the NIMR distinguished lecturer. She'll be presenting our research activities in the last 15 years in NIMR, in person of Dr. Agatha David. She's a pediatrician, and that will be starting around 4 p.m. Tomorrow we'll continue with the oral presentations, and we'll be closing the ceremony late afternoon tomorrow. Person will be our special guest of honor is the former Minister for State for Health, Dr. Tunji Alausa, who is now the current Minister for Education. He'll be closing our conference tomorrow, and hopefully everybody will have a good outing and enjoy all the research findings that will be presenting, and also have opportunity of networking and have further collaboration with everybody that will be attending the conference. So they are not just students, they are graduate students, some of them doing their PhDs, they are early career researchers. This kind of forum gives them the opportunity of showcasing their research work, giving them opportunity to meet senior researchers. There will be a lot of oral presentations they can learn from, and some of the skill building activities we'll be doing, they can also learn from that and help them with their future research activities.
A fellow of the GMTP 2023 cohort, and we've been trained on how to write grants and win grants for ourselves as academics. And we are here for the ICHAIR 2024 conference, where we are to present some of the research we have carried out after the GNTP 2023 training. And ICHAIR is a conference that pulled together people in biomedical sciences and professionals. And it is an eye-opening conference, especially for young ones, for them to learn, because conferences are places that you meet people, especially senior colleagues, mentors, that can recommend you for higher responsibilities, and you also interact with your peers from different universities. So this conference has opened up yet another opportunity for us to interact, collaborate, and forge ahead biomedical and clinical research in Nigeria. Yes, funding is very key in research. Without funding, you can't do meaningful research. In fact, you cannot use your salaries to conduct a meaningful research. So I want to use this opportunity to call on Mr. President, to increase funding, particularly to research, medical research, and generally research in Nigeria, so that our research will not be based on just for promotion, but rather all our problems, we can solve our problems via research. So if you fund research and the outcomes of the research, the recommendations, if actually articulated, will solve a lot of the numerous problems we have, particularly infectious disease as a low-income country, as a developing country. We have a lot of infectious diseases. So through research, we'll be able to turn around things for Nigeria, and we can become a disease-free nation at the long run.
Yeah, yearly, the conference has always been rewarding, starting with pre-conferences that engages students, giving them inputs about a lot of activities that is going on, training them, bringing outputs on research and all of that. So it's been rewarding, it's been educating, watching people present their abstracts and being able to win such a prestigious award is a very rewarding experience for me. Yeah, working on such research in Nigeria is quite challenging because of the limited infrastructure, but the fact that I'm here at the Nigerian Institute of Medical Research, it's a blessing because we have access to various facilities that are not common generally. And with this possibility, I've been able to gain access to limitless reagent materials that has supported the success of this research. And basically the research is looking towards developing biologicals like for diagnostics purposes and also vaccine development, which is a huge one for our country, so we can be confident in developing vaccines for our citizens. Thank you.
Well, it's extremely good. It's enlightening, educative. We have seen a lot of things, new researches coming, and it's very enlightening and encouraging. Well, it's extremely good. It helps young scholars, young researchers like us to actually get to know what is happening in the world of research. So this is an eye-opening conference, and we hope to see more and more organizations like NIMR to be sponsoring young researchers like us to this kind of conference. And we are very, very thankful to them. We appreciate what they have been doing. It was extremely good. They are taking very good. They're taking care of us extremely good. We are very grateful to them and all their sponsors and all the organizers. We are very grateful.
I really feel excited, and I'm really grateful to the Nigerian Institute of Medical Research, and then the Bill and Melinda Gates Foundation, the Japan International Cooperation Agency, JICA, for giving me this opportunity to come and mingle with like minds of my peers and also people of reputation in various fields. This is a good development because this will help groom young scholars, young researchers in the country, and we know that research is very important for the development of each and every country. So this is a good development, and I hope that this will continue and the pool should be expanded, I think, because this year I think the NIMR sponsored around 34 or 38 young scholars. There is need for the expansion of the pool. Though I know that there are financial constraints and all that, but there is actually need for sponsoring more young minds, because the young people are the future of the nation. So by coming and interacting with the elderly of the different medical fields and innovations, then we can promise that the country is on a good trajectory of development. Yes.
For me, and I mean, the Nigerian Institute of Medical Research, as it is the foremost organization that is supposed to promote research. So this kind of conference is important because it's a time to bring people from across all fields of healthcare research, preclinical, basic science, clinical and translational research. So essentially to be abreast of what people are working on, especially when it concerns the health and health research priorities of the country, which is what we are discussing and basically what we are talking about here.
So to really bring people together, to be able to rub minds and see what is obtainable. And just like the name, the ICHAIR is the National Conference of Health Research Advances. Yeah. So basically to see what are the advances, what are the innovations, and what is current in terms of public health and healthcare as a whole. Yeah. But seeing everybody here today, and the conversation that is currently going, it's, very heartwarming, because we can see that people are actually working on the things that really matter to Nigeria and Nigerians as a whole, and that's very important. So the foundation is actually an arm is a brainchild of NIMR itself. And our focus is on building capacity for translational research. So we work with early career researchers to build their capacity on manuscript writing, grant writing, so that they can support their own development. Without funding, you can actually do research. So we help them on how to write high quality proposals so that they can actually get funding to do their work. And so the people that have participated in the training, they've done some work, systematic reviews and scoping reviews, and that's what they've come here to present as part of the output of their work. And they are now writing proposals in order to get funding. So that's why they are here, and also to share what they have learned and what they are doing as researchers. Yeah.
The exercise has been very, very interesting. I've had cause to meet with different scientists from all over the world, and I've listened to many scientific sessions that has broadened my horizon and my knowledge. So this is the first time I will be attending this conference, and I hope that I won't like to miss it, and I've also been an advocate of this conference for other people to also attend this conference. Well, it was great, a wow moment, because I didn't expect it. I was just doing my own with my group members, but I know we put a lot of effort into it, and it's also a current topic, because our topic was on insecticide-treated net utilization for prevention of malaria among children in Africa, which in the last few days the Minister of Health say something that is alluded to that Nigeria loses more than $1 billion annually from the GDP to malaria. So it's a current topic, and our work is an evidence that more work needs to be done in order to eliminate malaria from Nigeria by 2030.
Well, it has been an exciting and equally educative moment right here at the Nigerian Institute of Medical Research at the occasion of the 2024 ICHAIR conference. Thank you for staying tuned. Do not forget to follow us on all our social media platforms on X, Facebook, and Instagram at Echo Hot Blog. I am Daniel Samson Idowu, reporting for Echo Hot Blog.